you, or someone you care about, has been taking Xanax for a while, you might already know it's not easy to stop. In fact, trying to quit suddenly can be dangerous, even life-threatening. But here's the truth. Detoxing from Xanax is possible, and with the right help, you can do it safely. Let's walk through what Xanax Detox really looks like so you know what to expect and how to prepare for a future without dependence. First, let's talk about what Xanax actually is. Xanax is the brand name for alprazolam, a short-acting benzodiazepine, usually prescribed for anxiety or panic disorders. It works by calming brain activity, and it's effective, but it also carries a risk. It's a Schedule IV controlled substance, meaning it has legitimate medical uses, but also the potential for abuse and dependence. Xanax typically peaks in your system within 1 to 2 hours, staying active for about 12 to 15 hours. Be aware that Xanax can be addictive. In fact, more than 4.8 million people misused benzodiazepines like Xanax in the last year. It's fast-acting, and that quick relief is part of what makes it easy to develop a tolerance and dependence, sometimes in just a few weeks. If you're wondering whether you, or someone close to you, might be addicted, look for these indicators. Physical signs like drowsiness, slurred speech, dizziness, nausea, coordination problems. Behavioral patterns, hiding pills, doctor shopping, buying illegally, skipping responsibilities. Psychological patterns like cravings, anxiety about running out, obsessing over the next dose. If you're recognizing more than a couple of these, it's a red flag. Now let's cover Xanax Detox. Detox is simply the process of getting Xanax out of your body, so your brain and body can adjust to functioning without it. But here's the thing. Detox isn't the whole solution. It's the first step. Think of it as the bridge to ongoing treatment like inpatient or outpatient rehab. Withdrawal can be rough, and it's different for everyone. About 44% of people experience moderate to severe symptoms. People who experience mild withdrawal will feel insomnia, anxiety, irritability, sweating, muscle aches. The next level, moderate withdrawal, will experience nausea, vomiting, panic attacks, sensitivity to light and sound, depression. People who experience severe withdrawal could have hallucinations, seizures, delirium. Those last ones can be life-threatening, which is why medical supervision is so important. Everyone's experience is different, but a Xanax withdrawal timeline usually follows these rough progression. The first 0 to 12 hours after your last dose, you might start to feel anxious, restless, maybe even get panic attacks, tremors, sweating, headaches, or nausea. From about day 1 to day 3, that's when things usually hit the hardest. Anxiety and restlessness peak, and this is when the seizure risk is highest. Between days 4 and 7, the physical stuff usually starts to calm down a bit, but insomnia often sticks around. And after a week or so, you could still deal with something called PAWS, post-acute withdrawal syndrome. That's where symptoms like depression or anxiety can linger for weeks, even months. It's not forever, but it can be tough, and having the right support makes a big difference. Stopping suddenly, or cold turkey, is dangerous. The seizure risk alone makes it a bad idea. It's much safer to taper under medical guidance. A safe taper usually means reducing your dose by 10 to 25% every 1 to 2 weeks, but your doctor will make a plan for you. Sometimes, switching to a longer-acting benzo like diazepam helps make the process smoother. Detox can happen in an inpatient facility or on an outpatient basis. Either way, you'll get medical support, emotional care, and therapy to stabilize you and prepare for long-term recovery. Let's go over the differences between inpatient versus outpatient Xanax Detox. Inpatient care receives 24/7 care, constant monitoring, and is typically a higher cost. This type of care is better for severe addiction or unstable home environments. Outpatient care clients can live at home, schedule check-ins with professionals, and typically cost less. This type of care is best for mild addiction and strong home support. Standard medications for Xanax withdrawal include diazepam or clonazepam for a smoother taper, hydroxyzine for anxiety, and gabapentin or other anticonvulsants to prevent seizures and help with sleep. The Xanax withdrawal timeline is closely linked to both the dosage and the length of time a person has been taking the medication. For individuals on a low daily dose, approximately 0.5 to 1 milligram for a few weeks to a couple of months, withdrawal often resolves within about 5 to 7 days. Moderate withdrawal is more likely for those taking 1 to 3 milligrams daily over several months to a year, with the acute phase generally lasting 1 to 2 weeks. Severe withdrawal is associated with higher doses over 3 milligrams daily used for a year or longer, or with repeated short-term high-dose use. In these cases, acute symptoms may persist for 2 weeks or longer, and post-acute withdrawal can last for several months. It is important to note that withdrawal from Xanax can pose serious health risks at any dosage. A medically supervised taper is always recommended to ensure safety and comfort. Detox is just the beginning. Next, you'll work with your care team on a treatment plan, possibly inpatient or outpatient, plus therapy, lifestyle changes, and coping strategies. If you have other mental health conditions, a dual diagnosis program is key. Here are a few of the most common FAQs around Xanax detoxing. Can Xanax withdrawal cause seizures? Yes, Xanax withdrawal can cause seizures. That's why it's so important to detox with a medical team who can monitor you and step in if needed. How long does Xanax withdrawal last? Acute withdrawal usually lasts about a week, but some people experience pause, post-acute withdrawal symptoms that can stick around for months. What's the safest way to detox from Xanax? The safest approach is under the care of a qualified medical detox team, whether you go inpatient or outpatient. When does Xanax withdrawal start? It can begin within 12 to 24 hours after your last dose. Can I detox from Xanax at home? No. Detoxing at home without supervision is not safe. The risks, especially seizures, are too high without medical oversight. How do you taper off Xanax? Most doctors recommend reducing your dose slowly, by about 10% to 25%, every 1 to 2 weeks, to keep withdrawal symptoms manageable and safe. Visit detox.com to find inpatient or outpatient facilities that can help you with Xanax detox.